Bismillahirrahmanirrahim. Assalamu alaikum. I am Sabreen Qasim from Biological Sciences 4th semester. My topic is coronavirus malaria. What is corona? Corona are a group of related viruses that cause disease in mammals and birds. In humans, coronaviruses cause respiratory tract infections that can range from mild to lethal. Discovery of corona. Coronaviruses were first discovered in the 1930s when an acute respiratory infection of domesticated chickens was shown to be caused by infectious bronchitis virus. Infectious bronchitis virus is a pathogen that causes disease in respiratory tract, kidney, gut, and reproductive system of chickens. Human coronaviruses were first discovered in the 1960s. Here is the illustration of morphology of coronavirus observed with an electron microscope, and the second one is the transmission electron micrograph of avian infectious bronchitis virus. Structure of corona. The average diameter of the virus particle is about 120 nanometer. The viral envelope consists of a lipid bilayer where the membrane, envelope, and spike structure proteins are ensured. Inside the envelope, there is a nucleocapsid which is formed from the multiple copies of nucleic acid protein which are bound to the positive single-stranded RNA genome. The lipid bilayer envelope membrane proteins and nucleic acid protects the virus when it is outside the host cell. Here is shown the structure of coronavirus. What is malaria? Malaria is a mosquito-borne infectious disease that affects humans and other animals. The disease is widespread in the tropical and subtropical regions that exist in a broad band around the equator. This includes much of sub-Saharan Africa, Asia, and Latin America. Approximately 93% of the cases and 94% of deaths occurred in Africa. Rate of disease have decreased from 2010 to 2014 but increased from 2015 to 2017, during which there were 231 million cases. Malaria is a serious tropical disease spread by mosquitoes. If it isn't diagnosed and treated, it can be fatal. Life cycle of malaria. First, an infected mosquito bites a non-infected person and transfer parasite of malaria into that person, and this parasite travels to the liver of the that person through bloodstream, and here they multiplies and reproduce asexually. When they become mature, they leaves the liver and infect red blood cells of that person, and it becomes infected. When a non-infected mosquito bites that infected person, the malaria parasite travels to that non-infected mosquito and it also becomes infected, and then it bites a non-infected person, and in this way the cycle repeats. Here is the comparison between corona and malaria. First, we see the transmission of corona. There is clear evidence of human to human transmission, possibly involving different modes of transmission such as droplet and contact transmission. Now we see the transmission of malaria. Malaria spreads when a mosquito becomes infected with the disease after biting an infected person, and that infected mosquito then bites a non-infected person. The malaria parasite enters that person's bloodstream and travel to the liver. When the parasite mature, they leave the liver and infect red blood cells. The transmission cycle of corona and malaria is shown in a diagram here. Symptoms of corona: fever, tiredness, dry cough. Some people may also experience itches, pains, nasal congestion, runny nose, and sore throat. Now we see the symptoms of malaria. A high temperature means fever, sweats and chills, headaches, vomiting, muscle pains, and diarrhea. Symptoms of corona and malaria are shown in a diagram. Patients with COVID-19 have experienced mild to severe respiratory illness. Symptoms can include fever, cough, shortness of breath. Symptoms of malaria: central headache, systematic fever, muscular fatigue and pain, back pain, skin chills and sweating, respiratory dry cough, spleen enlargement, stomach nausea and vomiting. Causes of corona. Researchers aren't sure what caused it. They are common in people and animals, including bats, camels, cats, and cattle. They all came from bats. Many people who got the disease early on were linked to a large leaf seafood and animal market in China. Causes of malaria. Malaria is caused by a type of parasite known as Plasmodium. There are many types of Plasmodium parasites, but only few 5 cause malaria in humans. The Plasmodium parasite is mainly spread by female Anopheles mosquitoes, which mainly bite at dusk and at night. When an infected mosquito bites a human, it passes the parasite into the bloodstream. Treatment for corona. There is currently no vaccine or treatment for COVID-19. Symptoms of a corona usually go away on their own way. If symptoms feel worse than a common cold, contact your doctor. He or she may prescribe pain or fever medication. Treatment of malaria. At present, we have a range of good tools including insecticide spraying and long-lasting insecticide-treated bed nets to prevent the transmission of the infection via the mosquito vector, but no preventive strategy is 100% effective. There will always be cases that slip through the net. There is no vaccine or drug for corona. RTS is the most advanced vaccine candidate against the most deadly form of human malaria, which is Plasmodium falciparum. Complications of corona. Some people about in 1 to 6 age will have complications, including some that are life threatening. Many of these complications may be caused by a condition known as cytokine release syndrome or cytokine storm. They can kill tissue and damage your organs, including your lungs, heart, and kidneys. Complications for malaria. It can also cause serious complications, including severe anemia and cerebral malaria. Severe anemia, where red blood cells are unable to carry enough oxygen around the body, leading to drowsiness and weakness. Cerebral malaria in rare cases. The small blood vessel leading to the brain can become blocked, causing seizures, brain damage, and coma. Preventions for corona. Wash your hands, often with soap or water, or clean them with an alcohol-based sanitizer. Cover your nose and mouth in public place. Practice social distancing. Preventions for malaria. Protect yourself from mosquito bites by sleeping under an insecticide treated mosquito net. Wear socks, long pants, long sleeve shirts, and blouses. Make sure the room doors and windows are closed properly and screened with gauze to prevent mosquitoes from getting in. Spray the room with an insecticide before entering. Preventions for corona COVID-19 are wash your hands, avoid contact with others, and wear face mask. And malaria prevention tools are powerful and cost effective. These are insecticide treated mosquito nets, indoor residual spraying of insecticides, preventive therapies for pregnant women, children, and infants in Africa. Precautions for corona are wear mask, wear gloves, and wash hands. Thank you.